Hello, I welcome you to this very important course of study today. We're going to be dealing with Introduction to Health and Safety in Healthcare. I am Lucky Amakiri Ike, and in this course, we're going to be dealing with very important aspects of health and safety, especially in healthcare. You must understand that health and safety cuts across every area of endeavor, every career area that is existent in the workforce. But we'll be narrowing our interest to healthcare. So if you're a healthcare professional, this is for you. Now, after this course has been done, after going through this course, I would expect that you'll be able to explain how to manage occupational health and safety in a healthcare environment. I also expect that you will be able to explain the safe system of work. I also expect from you to be able to outline the benefits of consultation in healthcare safety. You should also be able to recognize accidents and incidents in healthcare. And I also expect that you'll be able to outline the steps in an accident investigation. So this course is going to be very explanatory, and it is going to be very easy to be understood because I'm going to be able to break down some very important terminologies in this course. Now, because we're narrowing this course on healthcare, we're talking about how to prevent accident or injury in workplaces, especially in healthcare facilities, in our hospitals, in our clinics, in our eye clinics, in our laboratories, as diagnostic scientists, in our theaters as medical doctors, in our radiography rooms and all that. Every place where we work as medical professionals, how do we cut against accidents or injuries in those areas? That is what health and safety is all about. So this course is about helping us understand how to manage our environments, our equipments, and all that we use for work as efficiently as possible so as to be able to mitigate accidents and injuries as effectively as possible. So that is what we are going to be dealing with in this course. Scope of study. Now, these are the areas we're going to be covering in this particular course. We're going to be dealing with safety statements. We'll be dealing with components of safety statements. We'll also deal with safe systems of work. We'll also deal with safety consultations. I'm going to also take you on safety representatives. We would also see health and safety committee. We would also undertake information and relevant training. I would also be exposing to you investigations and how to conduct investigations. We're going to be dealing with these issues in this course. So as we go through this course, a lot of things are going to be exposed to us, things that really matter, things that will help you so you can become a health and safety expert in your workplace. You can begin to be the one to champion health and safety in your particular working place, in your hospital, in your establishment, in your organization, and wherever it is that you are applying your trade as a medical professional. Safety statement. What is safety statement? Now, a safety statement is a written action program for protecting the health and safety of employees while they work. It is, let's say, a rule book, or let's say a kind of a constitution that um, establishes an interest in seeing that employees do their work as effectively and as efficiently and as safely as possible, so as to guard against accidents or ill health coming as a result of their work. It is like having rules and regulations in place about how a medical professional, say a nurse or a medical lab scientist or a medical doctor, is supposed to carry out his duties, supposed to work in relation with his tools, with his patients, with whatever it is at his disposal, is how he's supposed to relate with humans and tools that are at his disposal, that he's supposed to work with, so as to be able to deliver his job as effectively and efficiently as possible without any commotions whatsoever. That is what a safety statement is all about. It's a document that gives us the laid down rules of how work must be done. It details how health and safety are managed in work, and it helps provide confidence to employees about the company's commitment towards their safety. So it is expected that the company, the hospital, the organization that you work with as a professional must have a safety statement that puts them on the toe, that actually covenants them with you, the employee, to the fact that they are interested in seeing that you do your work as safely as possible. Actually, it is legally binding on employers to have safety statements and be committed to the application of the same in their organizations. So we can also say that it is a paramount aspect of any company's operating procedure. It's kind of, let's say, it's a kind of an for every organization, how an organization is supposed to operate its organization, its works from A to Z. According to easylegaldoc.com, safety statement is a safety policy document that outlines a company's commitment to protecting the health and safety of its employees, visitors, and other stakeholders. Now, it is not only about the employees now, it is also involving visitors, those who come to those organizations, those who come into our hospitals, those who come to our laboratories, those who come to our area of where we offer services. We owe them the responsibility of making sure that they don't get hurt while they are in our environments, while they are in our facilities. So the owners of the facilities, the employers, whoever owns the facility, owes not just the employees, but visitors and even stakeholders, those who come in there to do one work or the other, agents, whatever responsibility they come in there to establish or to do, we owe them, or the company or the leaders of the organization owe them the responsibility of making sure that they do whatever they do there as safely as possible. So a safety statement must include the company's procedures for preventing and responding to accidents, injuries, and emergencies, including how the company complies with relevant health and safety laws or regulations. So even when certain accidents happen, certain issues happen, incidents happen, probably a fall, injuries or thereabout, the safety statement also makes it clear, stipulates clearly how such accidents, injuries, emergencies ought to be handled as efficiently as possible. That is what a safety statement is all about. Now, safety statements have different components, different aspects. And these are the aspects. 1, the introduction aspect of the safety statement. 2, duties and responsibilities. 3. Application. 4. Reporting. 5. Emergency plans. 6. Continuous education. 7. Monitoring and improvement. 8. Review and update. These are the major components of a safety statement. And we're going to be dealing with these one after the other so as to be able to understand what they all entail. What I'm talking about is that when you see a standard safety statement, it has to incorporate, or it has to comprise of these particular sub aspects: introduction, duties and responsibilities, application, reporting, emergency plans, continuous education, monitoring and improvement, review and update. So these make up a standard safety statement document. So while we go through them, you begin to understand exactly what we are talking about here.